Hi, welcome to the third part of our 4 series video on OET speaking. And as promised, today we'll have a look at how you can talk to a child patient. When talking to any patient for that matter, we need to make sure we simplify the language and avoid using a lot of medical terms. And when this is in regard to a child, we need to be careful to keep our conversation even more simple. For example, it would be really wrong to ask a child, "Do you suffer from palpitations?" I'm sure the child will never understand what palpitation is. And for that matter, this word could also be difficult for any other patient. So when we talk to a child, we need to make sure that we talk in very simple terms. Probably we can ask the child, "Do you find it really difficult to breathe?" That would be even more simpler and easy for a child to understand. So we need to keep these things in mind when we address a child. Also, the tone that we use to speak to a child should be kept in mind. We cannot be too harsh, but we shouldn't be too soft to a child either. We need to strike a balance there. We need to make sure that the child is comfortable in giving out the information. There could be a lot of examples of situations where the child is not very comfortable in giving out information. One such card is what we will see today. The case is bedwetting. The nurse will be talking to a child who is 10-year-old. The child is embarrassed already, so the nurse should be really careful when addressing the concern to the child. Let's see how this nurse will tackle this child patient. Arati, you have 3 minutes to prepare.
Okay.
You will start the role play after that time.
Okay.
I'll let you know when your 3 minutes are up.
Okay, ma'am.
You can ask me if there's anything that you're not sure about, and you can make notes on the roll card if you want to.
Okay, ma'am.
You can look at the card during the test, but you should return it to me after the test.
Sure.
This is the information for the role play for the profession of nursing. Your preparation time starts now.
Thank you.
Your role play will last for about 5 minutes. Don't worry if I stop you.
Okay, sure.
Can you please start now?
Yeah, sure.
Yes.
Hi, good afternoon.
Good afternoon.
Please be seated.
Thank you.
My name is Aradi. I'm the registered nurse who works here. How can I call you?
You can call me Michael.
Okay, Michael. Which standard are you studying now?
I'm in the 4th standard.
Are you here alone or anybody is here with you?
My mom is there with me. She's waiting outside.
That sounds you are a grown kid, right?
Yeah.
So how is your studies are going?
I think it's going fine. I'm doing quite well.
Okay. So, Michael, do you know exactly why you are here today?
No, but my mother had taken me to the doctor, I think some days back, and he asked me to come and talk to you.
Yes, yes. I have gone through your case note and I understood that you have bedwetting problem. Is that correct?
Yeah, that is there.
Okay, I do understand how you feel, but Michael, it's nothing to be embarrassed. Okay, this is quite common nowadays. If you are asking to your friends, they also may feel the same issues. Okay. And it's nothing. It's not because of you are lazy or you are disobedient. Because it's a quite common things, a common condition in your age. Okay.
But I feel bad about it.
I do understand your concern, because it will be a little difficult for you, because if how your siblings may tease you, or you may feel like you are a lazy boy or something like that. But please do not think in that way. Okay, so we are here to help you. Could you please tell me more about your drinking habit?
Can you tell me what you want to know?
Okay, so how often are you drinking fluids evening?
Evening?
Yes, at evening I want to know.
Well, I come back after school at around 4 o'clock and I go out to play football.
Okay.
And I don't carry a bottle with me when I go out to play. When I come back in the evening, I have my dinner and then my mom makes me drink a glass of water.
Okay, that's what your drinking habit, right? And would you mind if I ask you about your toilet habit?
What do you want to know?
So, are you using restroom in your in school?
Yes, but again, not I don't count how many times I go.
Okay.
But sometimes I don't use.
So you said me that you're drinking water at night also before going bed. Am I correct?
Yeah, sometimes I feel thirsty. Like I watch cartoon at night.
Okay.
And I feel like drinking maybe orange juice or something like that. Then I do have a glass of juice.
Okay. So before going bed, are you using the restroom?
Sometimes I fall off asleep while watching cartoons.
Okay.
But yes, yesterday I did use them.
Okay, Michael, this is not at all your fault. Okay, because your urine sac, it's not. Its capacity is not so much. So if you're drinking lots of water, so it's and you are involuntarily you're passing. Okay. So try to, what I have to tell you is, try to use restroom before you going to bed, and after 3 o'clock or after 4 o'clock, please try not to drink lots of carbonated drinks like Coca-Cola or Pepsi, or you can avoid some juices like citrus juices, orange juices and all. Okay. So and try to reduce.
Thank you, Arati. That's the end of your time.